diabetes management, if you get the tools and the support that you need and you have someone giving you that guidance, and then you get the practice, right? It doesn't have to be as hard as it feels in the beginning, for sure. And it doesn't have to stay feeling that hard where you're constantly on guard, you're judging those numbers all the time, you're feeling like a bad patient or a bad mom if your kiddo's numbers aren't good or whatever. It doesn't have to be that heavy. It can be smoother.
I saw it at the hand washing station at the entrance of the NICU. I see it in the playroom during medical play bingo. I see it near the fish tank in the surgery waiting room. There is a powerful unspoken language between two parents who have never met, but know in their deepest soul what the inside of a children's hospital feels like. It is joy and it is grief. It is love and it is fear. It is miracles and it is loss. This podcast exists to tell these stories. I'm Katie Taylor, a very proud child life specialist, and it is my honor to be your host of Inside the Children's Hospital. Hello, my friends. I'm so happy to be with you today. My name is Katie Taylor, and I'm so grateful that you chose to spend some time with us. Today's episode is well worth a listen. Our guest, Melissa, is a clinical pharmacist, and she says it in the beginning, but literally her whole career prepared her to be able to take care of her son. And she is actually not the first parent that we have had on this podcast who has ended up diagnosing their own child with type 1 diabetes because they saw the symptoms and knew the clues ahead of time. And because of that, it saved them a lot of hardship and turmoil in the beginning of the diagnosis period. Now, we're also going to get to another diagnosis, medical diagnosis that her son got and how the two are actually linked together. I didn't know about that, but apparently a lot of families who have type 1 diabetes also can have celiac in the same person and within the family. So talk about like complex carb counting and having to be so diligent about what goes in your child. We talk about all of it. So I'm going to stop speaking now so we can get to our conversation. But thank you so much, Melissa, for being here. Excited to chat with you because I think you bring a lot of kind of dynamic expertise, both in the parenting a child with medical needs, but also your clinical background. And how you're marrying those two things together right now is really, really impressive. Why don't you start off and just tell us a little bit about you, Melissa, who you are, where you're from, and just about you.
Yeah, thanks, Katie. I am from the Buffalo area of New York State. I am a clinical pharmacist, and my story is sort of bizarre. I think one of the things I say all of the time is that my entire career was prepping me or training me to take care of my kiddo. I have been a clinical pharmacist managing type 1 diabetes for, 15 years now. And 4 years ago, I diagnosed my youngest kiddo, who was 6 at the time, as a type 1 diabetic. And our journey just looked much different than what I experienced watching patients in clinic, and what they were going through. And that led me on this journey to kind of offer different things to people because our journey was so much easier than what other people were going through. And so to kind of step back and give you like a little bit of the story of leading up to that, um, one of the moments that I think was pivotal is Caleb was 5 and we're sitting in a gastroenterologist office. It's 4:30 in the afternoon. I thought it was a routine follow-up after having an endoscopy. I did not expect to see anything really happen out of this appointment. It was just, I thought, routine follow-up. He'd been nauseous, vomiting for months. His blood work had come back fine. He was negative for celiac in his blood work. So I was not expecting his celiac diagnosis, which is what we got. I was literally thinking about what kind of takeout we were going to get on the way home because it was a 4:30 in the afternoon
Yeah.
appointment. And all parents know by the time you get out of the doctor's office and get home, you just want something easy, right? You're not making dinner. And the doctor comes in and says, he has celiacs and starts explaining that we need separate pots and pans and we need separate toaster and we have to avoid anything that has wheat and gluten and barley and rye and worry about cross contamination and where we store things in the fridge and the pantry. And I'm just like, what am I going to feed my child today, right now? I have nothing that I know is safe for him. I have no idea how to cook something safe for him.
Yeah.
I don't have gluten-free pans at home. Like, what am I supposed to do today? And I was already a pharmacist. I was already in the healthcare space. I knew more than most people knew about pretty much any diagnosis. And I still felt completely overwhelmed. But the reality is that moment was hard, but it didn't break me because it wasn't the hardest thing I'd ever done.
Mm.
I had already been through a crazy bunch of circumstances of chronic health issues in my family. My husband was in a motorcycle accident my first week of pharmacy school. We didn't know if he would live. We didn't know if he would ever walk again once we realized he would live. He was in the ICU for a week, the hospital for a month, had 15 surgeries during my 4 years of pharmacy school, which is really intense, like medical school. Lots of people ask me why I did not quit. That never even occurred to me. I didn't understand how quitting school would have been helpful for me in that situation. So I finished pharmacy school anyways. And then our oldest was born in 2013. He had severe infant reflux, was not gaining weight, was, kind of spitting up all the time. We got through that. Then he had a severe speech delay, didn't say a single word until he was 3. So we went through the workup for that. We did, hearing tests and cognitive delay tests and all of the things. And then in 2016, my youngest was born and he was healthy then. He was born in February. In May or June, my husband suffered second and third degree burns from an explosion. So I had a toddler who was not speaking at that point and was very frustrated, couldn't communicate. I had an infant and an injured husband. Um, so that was 2016. In 2019, my husband had his cerebral artery that goes up from the neck into the brain tore, and he had 2 strokes. And then COVID hit in 2020, and we were homeschooling a pre-K kiddo and a first grader, which was very challenging. We had one singing and dancing songs and one trying to
Right.
take a spelling test. And as everyone who homeschooled through COVID knows, that was challenging for sure.
Yeah.
Um, and through all of that, I was a clinical pharmacist managing patients on call 24/7, had stepped up in my role at work, became the director of the department, was leading a team. I'd gotten really good at this surviving the chaos kind of
Mm.
thing. But then Caleb's celiac diagnosis just kind of hit me, and it was like, this is so much.
Yeah.
When do we get a break here?
Yeah.
And I realized that I needed to do some things. I didn't want to just be thriving. So that is where kind of my personal development journey started.
Mm.
I worked with a coach. I worked on challenging limiting beliefs. I worked on challenging that, I had kind of gotten used to overwhelm, and that was sort of now my comfort zone of where I lived. Um, and so I worked through those kind of things. And then when Caleb was then diagnosed, well, we diagnosed him in 2022, our journey just looked so different because I had already done so much work. I'd already done a lot of hard things. I'd already challenged a lot of the beliefs that come with chronic health issues. And so when he was diagnosed, I did all of the things that I knew needed to be done. I got him on a sensor right away. I got him on a pump, an insulin pump right away. I built processes and systems to make this smoother for us and easier for us. I advocated for him. I got him involved. I taught him how to advocate for himself with the school nurses. And that's when I really realized most of my patients come in feeling incredibly overwhelmed by this diagnosis, incredibly frustrated. They often come in almost like the stages of grief, right? They come in denial or angry that this is happening to them. And our journey was just so much different. And I realized that people need something different than what the healthcare system offers. The healthcare system offers some education, nowhere near enough. Um, and it doesn't offer much support in the way of teaching people the things outside of the clinical stuff. Like, yeah, having that clinical background was huge for me. I knew how to dose insulin, I knew which insulin pump to choose, all of those things that are really challenging. But more than that, I knew to look at his numbers as data, not as a judgment of that's a bad blood sugar or a good blood sugar, or we're doing it right or we're doing it wrong, not
Mm.
assigning like a moral value to a blood sugar number, which most people with type 1 diabetes do. You hear it all the time. Oh, I'm a bad diabetic, or I have good numbers this week. Okay, but they're just numbers, they're not morals.
Yeah.
And so I saw that really we needed to provide more of that kind of thing. We need to build systems and processes. The number of patients who have called me on vacation because they ran out of something and needed an urgent supply sent to a pharmacy near them. The number of people who even just out and about or have an issue with their insulin pump at home and don't have backup supplies. I have a system for making sure we always have backup supplies, extra supplies with us, a plan. Everybody knows the plan. Everybody's on the same page. We have like a diabetes go bag that has everything in it that my kiddo needs if we leave the house. So building those systems and processes, the healthcare system doesn't teach that. You just figure it out as you go. And when you're in a crisis and you realize this didn't work, what do I do different next time?
Yeah.
Yeah.
I have so many questions that are just like ruminating in my brain. I want to start a little bit from the beginning and take you back to that celiac appointment. What do you remember? I have so many questions. Was your son there with you? Because it was like this follow up, and
Yeah.
you didn't have your husband or partner with you? What did you end up eating for dinner? Like, what did you end up doing?
Well, when we walked out of the appointment, I called my husband and I was like telling him to look at everything in the pantry to see
Yeah,
if there was something that my kiddo could eat. And it really was like, okay, we have a cereal at home that is gluten free. So it is cereal for dinner in a glass bowl because glass is safe to use for celiac because nothing the gluten residue doesn't stick to it.
yeah,
Anything like a, pan that has, like, a nonstick coating or anything like that, it can have little or plastic, little, like, nicks or scratches or scuffs in it where gluten can get stuck and potentially make that celiac kiddo sick. So I was like, "Okay, cereal and a glass bowl, that's what
yeah.
we're doing tonight." And then we after we got my son to bed, we're literally, like, overnighting everything to our house, trying to get
Sure.
stuff and looking for groceries, and it was challenging for sure.
Yeah, it's like talk about the like, okay, here's a life altering diagnosis. Bye. And it's not that it's the doctor's fault. It is the system's fault that I feel like there needs to be this like go bag, like you said, every celiac diagnosis. Here's your new pots and pans. Here's your new this and that. Here's your meal plan for the next week. Just to take off that mental load. Did you end up connecting with any other families like soon after? I can imagine I would just be terrible pun, but very hungry to like meet a family that is like
Yeah.
navigating this.
Yeah, so fortunately and unfortunately, type 1 and celiac actually are very closely related. A lot of people who have one may have the other, certainly not all, but they are, diseases that often run together. So I actually have a few patients who were my patients as type 1 diabetics who also had celiacs, and I knew that, so I honestly called them, and I was like, "Hey, do you have any tips or tricks?" And this one lady who's so fantastic, she also has a family member who the kiddos have celiac, and she's like, "I have lots of things I can tell you, but let me put you in touch with whoever it is, her daughter, her niece, whatever. She has little kiddos, and she is going to be so helpful to you because she's gonna know, like, the goldfish cracker kind of snacks, not
Yes.
the, like, a grown adult, I eat
Yeah,
different things."
right.
So that was fantastic, and this woman was so helpful and so, ready to chat with me, and she really helped me with figuring out the kitchen and, like, how to set up the kitchen and what things to worry about, things I never thought about, like separate hand towels in the kitchen if we were gonna have gluten in the house, like, we have different colors of everything, so our kitchen
Mhm.
is 2 colors, one color is the gluten-free stuff,
Wow.
and one is the stuff that may potentially be exposed to gluten.
I can imagine too that you would also have to sift through a lot of the community education on carb counting for diabetes because it's another limitation in a diet. Have I guess it is probably nice that you know people who have both type 1 diabetes and celiacs, but can you talk a little bit about kind of having to sift through not okay, now here's another diagnosis, but we can't have this type of carbohydrate. We have to have this. Was that a hard balancing act and how have you adjusted?
Yeah, we were already kind of used to being gluten-free by the time he got his type 1 diagnosis. Um, so we were already eating mostly gluten-free things, things that come with a label, like a lot of gluten-free products that we buy are fine, or if you I use like an app for carb counting where you can put your own recipe in. So if I make something with like a gluten-free flour, I can just put that particular flour brand in and it'll give me a label. What I do think was really challenging, which we don't do often because there are not a lot of gluten-free restaurants around near us, but when we plan vacations, we always try to find some in the area that we're vacationing, and so that I think is really challenging. It's hard enough to guess the carbs when you're eating out, and
Right.
so his insulin dosing is based on his carbs. We have to put the exact number of grams of carbs into his pump, and so if you're getting, say, pancakes out at a gluten-free restaurant, okay, if they're made with rice flour, that's a lot of carbohydrate. If they're made with almond flour, it's a much lower number, and you don't know how they made it. Pancakes
Yeah.
taste like pancakes.
Yeah. Oh my gosh.
And so
I
I find those things to be super challenging because you're just kinda guessing and then hoping for the best. You can ask, the restaurant, but sometimes they don't know.
and
Sometimes
they
it's a
might get it
gluten-free
wrong and
mix. Yeah.
what is the name of the app that you use for carb counting?
I use
You know?
MyFitnessPal. There are
Okay.
tons of other
Yeah.
ones, but MyFitnessPal I had already been familiar with MyFitnessPal, and it has a great option to, like, put in recipes and save your own foods, which is great for things that you make at home. You can put in all your ingredients, say this makes, whatever, 18 cookies, and it'll give you a carb count for each cookie, so it's super nice.
That's great. I wanna also I'm so interested in your kind of personal development journey and also this beautiful analytical brain that you get to bring, in your clinical work, but also with looking at numbers. And, I've heard about assigning like moral identity to different foods, like ice cream is bad and asparagus is
Yeah.
good. Um, and I don't think I've ever made the crossover that numbers are perceived that way when your child has a diagnosis. But of course it is because it's like this guilt that can live inside all of us. And was that an immediate shift for you because of your training, or did that come a little bit later?
I think that I had already kind of worked on this with patients a lot because I saw the toll that it takes on patients when they come in and they have a bad A1C or bad blood sugars. I mean, sometimes people before they even like hand me their insulin pump or let me pull up their data, they're like, my numbers are really bad today because blah, 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 whatever happened. Right.
Yeah.
And I'm like, it's okay. Like, I'm not going to yell at you, but most patients have had an experience where they have been yelled at for their numbers not being under good control, and healthcare providers are trying to help, right? They know that these numbers increase the risk of complications and something bad can happen to the patient, but we often in healthcare have this tendency to shame people, not necessarily purposefully, but that's often how it comes across. And so I had worked really hard with patients on changing that mindset, that the same thing you said about food. I have the same thing with people coming in saying, you know, that their number isn't good because they ate bad last night. And I'm like, well, but food doesn't have morals.
Yeah.
It just doesn't, and neither do these numbers. They're just data. They're telling us things. They're important. I'm not saying we ignore them, right?
Right.
But what are they telling us? They're not telling us you're a bad person. That's not what
Yeah.
they're telling us.
Yeah. Wow. I can imagine you can find yourself applying that to a lot of different things in life, and it probably becomes a really helpful tool.
Yes. And I think a lot of the like, doing that with patients and seeing their struggle, and then all of the personal development I worked on to, like, challenge these beliefs that we have that are not serving us. They're not helping us be healthier. They're not helping us be happier. They're not helping us hit our goals. They're just
Mm,
deterring us.
yeah.
Using that sort of mindset work, to this concept.
Yeah. The negativity can be a barrier that it's not like a physical barrier, but it can keep you from moving forward. And putting together that bag of to go bag that you need every time you leave the house, it can just be that mental and emotional weight.
Yeah. People have so much resistance around doing some of these things. They don't want to be different. They don't want to have to think about their diabetes all the time.
Mm.
And I'm like, yeah, that's the purpose of the go bag. You don't have to think about you have everything. You just have to grab the bag.
Yeah. Yeah.
Of kind of
Yeah.
making that shift of, okay, I think about it once and I have it set up and I just have to grab the one thing instead of every time I leave the house, I have this huge checklist of things I have to make sure that I have with me.
Can you talk a little bit about maybe the way you were a caregiver from when your husband had that horrible accident versus the caregiver you are today? And of course, that's come with a ton of time and ups and downs and challenges and learnings. But what are some tangible differences you are doing now that you maybe didn't do back then just because when you have never done it before, you don't know to do it?
For sure. I mean, I'm a completely different human. For one, I was like, whatever, 21 or 22 or
Oh,
something when his
so
accident
young.
happened.
Oh
Yeah,
my god.
just a baby compared to
A
now. So I
baby.
definitely didn't have any of the life skills that I've
Yeah,
developed through all of
yeah.
this. But I think some of the big things would be um, one of the things that my career really taught me is that I cannot care about your health more than you do. And sometimes that sounds kind of mean, like, it doesn't mean I don't care, but I can't care more than you do. It's
Mhm.
your health. And and with a child, there's a little bit of a difference because they don't fully understand. So you can't, when they're 3, that's a little different story.
Yeah,
But you do have to give other people the autonomy to do the parts that they can do that are age appropriate depending on where that child is. In the case of my husband as an adult, you have to give them that autonomy, and if you don't, you're not really helping them, and you end up getting really frustrated, right?
yeah,
Because you're like, why aren't you doing this thing that I told you to do? Well,
yeah.
you don't know what their experience is really feeling like at that moment.
Mhm.
And maybe if you were in their shoes, you wouldn't do it either, even if
Yeah,
it is a helpful idea.
the right thing to
Uh,
do, yeah. Did that feel
so
scary to
so
let go of the reins a little bit?
for sure. I mean, pharmacists are notoriously type A and slightly neurotic at
I didn't
it's what
even
makes
think of
them good at
that.
their job.
Yeah,
Because they have to be very detail orientated, and typically they are, that type A personality. So for sure it is challenging, and sometimes it's still challenging, right? Like my kiddo is 10 now, and I have really tried to teach him to do a lot for himself because the reality is I am not with him 24/7. He will fully have to manage this completely on his own at some point, not today, but we don't know
Yeah.
when those reins fully transition, right? And it's alarming, just like anything you learn throughout childhood. You don't have mom and dad doing everything, spoon feeding you, cutting up your meat, and then one day you're 18 and you're on your own,
Yeah.
right? That
Yeah, yeah,
doesn't
yeah.
work. And the same thing applies to blood sugar management. So he has been super involved from the beginning. He puts his own sensors on, he puts his own infusion set on for his pump. He can push the buttons on his pump to give insulin himself. Yes, we supervise these things. He
Yeah.
can do his own finger sticks.
Wow.
It was his third insulin injection. He did it by himself.
Yeah.
Again, we watched, we made sure it was the right
Of
dose,
course.
but he
Yeah.
did it by himself. He was 6.
Mm.
Um, so I think, giving that autonomy was always really important to me, but that doesn't mean there's moments that it's not hard. Sometimes I see his blood sugar doing something because I get alerts on my phone, my watch. I'm always
Yeah.
kind of aware. Um, and you have to decide when you're going to step in and when you're going to let him kind of learn and give him a few minutes to figure it out himself and see what he can do. Because again, someday I'm not going to be looking at his numbers 24/7, or he's going to be
Yeah.
old enough that he's not going to answer the phone when I call.
Yeah, it's a message that it's it's not black or white because you're right, we have to teach kids that they're capable and that
Mhm.
they can and that we trust them. And then there's also
Yep.
this like whole lived experience you have with having to have a different set of kitchen knives and having a husband who had 15 surgeries and you worked with, so it's like, ooh, it's difficult. It's difficult.
Huh. Yeah. But it is so important because the fact that he has learned so much, and again, I started everything when he was first diagnosed. I tried to get him to do as much as possible with supervision, but on his own physically doing it. And it makes a huge difference. He had a substitute nurse at school a couple of months ago who wanted to do things different than what really needed to be done, and he is able to advocate for himself. He was like, "No," his blood sugar was low. He treated it with the appropriate treatment that he's supposed to use, and then he just has to wait. And it's
Yeah.
sometimes it feels like a really long time, especially to a very nervous nurse who doesn't know you very well.
Yeah.
Um, and she kept telling him to eat more, and he was like, "No, I do not need more." And she kept pushing it, and he was like, "I am not eating anything else. Call my mom." And I
Yeah.
think a lot of kids wouldn't be able to
Huge.
do that, right?
Yeah.
But he's very confident. He was joking with me, same substitute nurse is back actually right now,
Yeah.
and he was joking with me. He was like, "She thinks that I'm just a kid who doesn't know anything about diabetes, but I know way more than her." And I'm like,
Yeah.
"You're right. You do. You live it all day, every day." Her experiences, you know, a little bit of nursing school, which is very limited what you learn about type 1 diabetes,
Yeah.
and then, seeing kids in school here or there who have to come in for a dose once a day, she sees them usually. Like,
Yeah.
you live this 24/7. Of course you know more.
It makes me think of, like, so many scenarios in the hospital where, um, this is, just an example. So, let's say you bring your child in, you know they're gonna need blood work. You know there's one vein that never works, but you've got a new nurse who's never seen your child before, and they're like, "This one looks really good," and you're like, "I know, but it does not work." And you're doing that dance of respect because you're the one, who's here
Mhm.
to do this,
Yeah.
but I know my child best.
Mhm.
Can you talk a little bit about like, I love that and kids can kind of get away with saying like, "No, I'm not doing this," because but as a parent, um, it's a slippery slope. Here, we absolutely want you to advocate and to do it in a really respectful way that actually builds on collaboration and partnership and doesn't set this rift between the two of you, but it can be a dance.
For sure. We are very fortunate that our normal school nurse is wonderful and we have a
Yeah.
great collaboration with her. We text all day. She's fantastic. In fact, even while she is on vacation with the substitute nurse in, she sent me a message to check on my kiddo because she saw what was happening with his blood sugars the one day at school.
Oh my gosh, what does that feel like?
I mean, it's amazing, and I dread when we have a different school nurse when he moves on to the next school because she has been so phenomenal to work with. But the substitutes are always a challenge, and I hear from so many clients that the school nurse is, like, their biggest challenge because the school nurses the reality is the biggest thing they're afraid of is a really bad low, right? This again sounds mean, I don't mean it to sound mean, but they don't care if your kid has kidney failure in 30 years.
Yeah. Yeah, yeah,
They're not
yeah.
gonna be around for that.
Yeah.
They care about them not passing out today, right now,
Mm,
in their care. That's it. They don't wanna have to call 911. And
yeah.
so I understand where they're coming from, like, that's what they're trying to prevent is that right now problem, right? But it is definitely a definite dance to figure out how to get them on the same page and to collaborate, and sometimes it's smooth and easy, and the nurses are great, and they follow everything the doctor puts in the plan for you, and other times,
They just don't.
you're you're advocating a little bit more.
Mm. One of the things that you wrote about before you and I talked today was really the reality that a lot of medical parents face when their child needs constant supervision. Um, and that's that you don't get a lot of time away. And the field trips that don't include mom, you had an example about him going to a wedding that you weren't at, and that just is the reality. And we can talk about self-care till we're blue in the face, but that self-care can't really include a weekend away.
For sure. Yeah, I mean, my husband and I, we really don't leave our son with almost anyone besides the school nurse.
Yeah.
Um, we left him with my parents for a wedding, and it was really, really challenging, and I said, "Next time you're going" my husband, "You're going to the wedding on your own," because
Yeah.
it just did not it just did not go well. My parents
Yeah.
weren't equipped to handle the situation, and, my son had a really bad low, and they had left the house, and they didn't take anything with them. I don't know why. They didn't tell us they were gonna leave the house. It
Yeah.
was just really, really challenging, and we just don't leave him usually because it is not super safe, and as he gets older, that will look a little bit different because he'll be a little bit better equipped to manage things on his own, and he's getting there, right, little by little, but
Yeah.
he is a kid.
Yeah.
Grandma and grandpa were super excited to take him to an alpaca farm. He got all excited and completely forgot to grab his go bag that is supposed to
Right.
go with him everywhere.
Yeah. Yeah. It's difficult, and I feel so much for these families like yours who are diagnosed at a young age, and we recently had Marley and Bane on. I don't know if you follow them on Instagram. I have to send them to you, Melissa. It's the
Yes,
cutest family, but a 12-month diagnosis is like it's a full decade then of little by little and teaching and not having time away, and it's a real, it can be a challenge.
for sure, and my husband and I do a good job of, like, giving each other breaks,
Mhm.
and yes, that means sometimes we're not getting those breaks together, but we
Yeah.
give each other
But it's
breaks.
yeah.
And then the other thing that we have incorporated to make sure that we still have some couples time is during the school year when he is in school, we try to have a day date from time to time. We'll go out to lunch instead of dinner because he's at school, he's with the nurse, he's safe.
Yeah. Yeah, it's super smart. I love it. I love it.
So you
Well,
just have to
talk
be creative.
yeah, yeah, yeah. So talk about this transition from being this amazing director at a hospital over pharmacists to what you're doing now and what it looks like.
Yeah, so I think the thing that I saw the most is that with my patients, I try to do some of this, what I kind of would say is a little bit more like life coaching than truly diabetes management. Yes, we're doing the diabetes management, of course, but honestly, that part's easy for me.
Yeah.
And it doesn't take as much time to teach those skills when you're really comfortable in it and you've been working with a patient for a while. I spend a ton of time or I love spending time doing the more like, okay, let's challenge these beliefs. Let's set up a system or a process. Like, make sure we have that go bag. Let's create the routine where once a year we check and we make sure we have all of the backup supplies that we need and nothing's expired and, building systems.
Yeah.
Unfortunately, the healthcare system doesn't lend itself to that very well. So I do try to do it at work, but it's limited, right?
Yeah.
So I have really found that I want to spend more time doing that and more time helping these families who have tried to go through the healthcare system and are doing the best they can, but really are just not getting the support that they need. I'm able to, in my own coaching program, work really closely with people, have a lot more frequent contact. We don't have to go by the insurance company rules of how often we can be seen or,
Mhm.
follow this healthcare model. And we can spend the time on the things that whatever they're struggling with. That could be anything. That could be, how do we teach our kid to advocate with the school nurse? How do we do this system? What go bag do we need? What process do we need for this? Instead of um, just focusing on the, hey, we're going to talk about your carb counting today. We're going to talk about whatever thing is on the doctor's checklist, right? It's
Yeah.
whatever the client needs. And then, like I said, we can do that much more frequently than most doctors' offices can. We can do really close contact. We get weekly check ins to build that kind of support that they need more than just an appointment.
How do families find you?
So you can find me on Instagram. I have my podcast, Insulin Inspired. I have my website as well. It's a great option to book a discovery call. They're free. We just chat through what are your family's needs? What are you struggling with? Am I the right fit to help you out? And what does that look like?
Okay. And your Instagram is Melissa APA underscore, correct?
Correct.
Okay,
Thank you.
awesome. There's a few Melissa Appas out there. I had to look, but the underscore was helpful.
Yes. Yeah, I had
And
to
I
put an underscore in there.
yeah, they always have something that makes it look a little fun and wonky, right? I really appreciate you sharing so honestly about what this has been like for you. Are there any pieces of wisdom that you were hoping to share that I didn't ask you
I
about?
think the biggest thing is really just it doesn't have to be this hard. And I don't mean that to say it's going to feel easy all the time. I kind of liken diabetes management, and you could really use this with any chronic illness, as like driving a car. If I put you in the driver's seat, but you had never seen a car, never seen a steering wheel, a stop sign, a red light, a gas pedal, a brake pedal, windshield wipers, turning signals, you'd be like, what do you mean drive? What do
Yeah,
all these things do?
yeah,
But that's not how we learn to drive, right? We learn probably from the time we start to toddle around, watching mom drive the car or dad drive the car, watching them move the steering wheel. And then when we finally get behind the wheel, we don't know how to drive yet, but we're well aware of what a red light means from playing red light, green light in pre K, right?
yeah,
And it's still hard when you first learn to drive. You're still not quite sure how much do I turn the wheel to keep it between the lines? How hard do I push the gas or brake? But then you do it for a little bit. And now, if someone's like, hey, how do you keep the car between the lines? You're like, I don't know. I just do. I don't even
yeah.
think about it. Right. And that's how diabetes management really can look if you get the tools and the support that you need and you have someone giving you that guidance and then you get the practice, right? It doesn't have to be as hard as it feels in the beginning for sure. And it doesn't have to stay feeling that hard where you're constantly on guard, you're judging those numbers all the time, you're feeling like a bad patient or a bad mom if your kiddo's numbers aren't good or whatever. It doesn't have to be that heavy. It
Mm.
can be smoother.
It's such a message of hope. Like you're not going to live in the scary, dark, uncertain, terrifying place forever. Like you're going to get to be driving the car again and you're going to back out and you're going to do a great job. You're going to drive cross country and you're going to be okay.
And you're not even gonna think about it. And that
You're not
doesn't mean
even
there won't
think
be hard moments.
for
You
sure.
might be in a blizzard today, and it might be you're really focusing and it's slippery and it's scary, and then you drive
Yeah.
out of the blizzard or the blizzard ends and it's okay again, right?
Yeah.
So there's still bumps along the road. It's not 100% smooth, but, it can be much, much easier if you get the tools and the support that you need.
Wonderful. Well, thank you so much, Melissa. It was wonderful to talk with you.
Thank you, Katie. I appreciate it, and I love getting the chance to chat with you, and I love what you're doing.
Me too. Thank you so much. For those of you who are joining us today, I am not a doctor. I'm not a therapist. I am a child life specialist. And the suggestions and tips and resources that I talk about with parents on this podcast may be great for you and they may not be right for you. So, the most important person you can talk to about getting support is your care team, your doctor who knows your story and your child's story. So, regardless of maybe what I mention or what other families mention here, we're not licensed therapists, we're not doctors. We're having a conversation about what the parenting journey has been like. So, please keep that in mind as you listen today.